Hello, I'm James Irdang. I'm a physical therapist and professor and chair of the Department of Physical Therapy at the University of Pittsburgh. This study was done as part of a clinical trial development award that was received from the Department of Defense Congressionally Directed Medical Research Program. The aim of the award was to plan for a multi-site randomized clinical trial to determine the effects of the timing of surgery and postoperative rehabilitation for the treatment of multiple ligament knee injuries. The results of this multi-center retrospective study of multiple ligament knee injuries were used to inform the eligibility criteria and the number of sites needed for the trial. We used the results to make the determination to exclude patients with injuries requiring external fixators or stage surgeries, given the challenges it created on randomizing the timing of surgery and rehabilitation, and the small number of cases requiring these interventions. Additionally, we used the data on average time from injury to presentation to the treating orthopedic surgeon and time to surgery to determine an appropriate window for recruitment that would allow for recruitment of a sufficient number of participants for an early surgery group. This paper is also a great example of how the review process is intended to work and led to a much improved paper thanks to the feedback of the reviewers and editors. We received feedback that the definition of a multiple ligament knee injury was unclear and that the knee dislocation or KD classification developed by Dr. Robert Skank was not appropriate to use for this study, as not all multiple ligament knee injuries were knee dislocations. Through several iterations and feedback from the reviewers, with input from our co-investigators, including Dr. Skank, we refined the definition of a multiple ligament knee injury. Further, to address the concerns over the KD classification, we developed and applied a pathoanatomical classification system specifically for multiple ligament knee injuries that was based on the ligaments that were injured. The STAR Trial Network was uniquely positioned to develop this new multiple ligament knee injury classification system because of the expertise of this group of surgeons, physical therapists, and clinical researchers in the diagnosis and treatment of these complex knee injuries. A better understanding of the characteristics and management of different multiple ligament knee injury patterns that was gained from this study can be used to support clinical decision-making and individualized treatment for these knee injuries. This may lead to enhanced outcomes and reduce the associated risk of treatment. The clinical benefits of the multiple ligament knee injury classification system that was developed for the study on treatment outcomes for these complex injuries remains to be seen. To that end, we are currently conducting the STAR trial for multiple ligament knee injuries. It is a multi-center, international, randomized clinical trial to determine the effects of timing of surgery and postoperative rehabilitation on the time to return to pre-injury activity and patient-reported physical function for the treatment of multiple ligament knee injuries in military personnel and civilians. Finally, we'd like to thank the Department of Defense peer-reviewed orthopedic research program for their ongoing support of our multiple ligament knee injury research program. Thank you.